Good morning and welcome to the program Perspectives. This morning, Perspectives on Invicta 98.9. And today's program, Thursday, it's sponsored by Kaduna State Ministry of Health. And we will be talking about COVID 19 in Kaduna State, in Nigeria, and where we are with it. My guest this morning is Dr. OYEFABI ADEGBOYEGA Moses, consultant, public health physician, Barao Dikko Teaching Hospital, senior lecturer, Kaduna State University, and team lead, Infectious Disease Control Centers, Kaduna. And we're talking about where we are with COVID 19. Dr. Oyefabi, good morning. I'm glad to have you here with us.
Good morning.
Yes.
Thank you.
All right. I would like to go national now and again a little bit general this time to talk about the situation in Nigeria, and we'll come back home with it. COVID 19, is frightening. What is coming out now is, becoming so very frightening, and of course, challenges are there. But Nigerians, do we really believe that COVID 19 is here with us or is all gone with the wind, as some would say? But the figures, as they're coming out now, they are not, something to cheer about. It's something to be very, very worried about. Right now, we do know that the federal government has said that examinations for GS and secondary schools, have been cancelled. We also know that schools are not to be reopened. Our markets are shut down, some will say. And of course, the protocols put in place, to save us, to make us safe from COVID 19. All of that, have been thrown to the wind by some people. And so where we are with COVID 19 in Nigeria and come back home with it in Kaduna State.
Thank you very much, Mr. Toyin. COVID 19 is real in Nigeria. And since the first case in February this year, we have had quite a number of cases in this country. As at today, we have more than 29,879 cases, confirmed cases in the country. More than, when I say more than, because these figures are yesterday, so I'm coming here now. The figures are rising, it is such. And total discharges in Nigeria, as at yesterday, is 12,108. That's at 8th of July, 2020. Total tested in Nigeria. Nigeria, we have more than 200 million people. But we have tested over 152,000 only. 952. And out of these cases, I've told you, more than 29,000 are confirmed cases. Lagos still leading the country. More than 20% of the cases only from one state, not from Lagos State, and other states accounting for other percentages of the cases. And if you remember, the curfew has been directed by Mr. President just for the control of the lockdown. And that started 30th of March this year, up to April 13th this year. Was extended by another 2 weeks. And that lasted up to 27th of April, when the president declared overnight curfew as part of measure to contain the spread of the pandemic. So the cases have been increasing in the country, but after some time, there's a need to ease the lockdown. Those are, as I've told you, and government have to consider the plight of the citizen, then of course the economic situation. There were a lot of cry that people are suffering, and again the economic situation of the country is coming down. So there's a need for government to reconsider. So after a lot of deliberation, there was a need to start easing the lockdown in phases. And that is what we are currently experiencing. But just as we have said, both nationally and locally in Kaduna State. In Kaduna now, we As at yesterday, we have 889 cases, and the cases are still mounting up. And we have discharged more than 500 cases in the state. But the challenge that we are facing, one of the major challenge is this disbelief about COVID. I was somewhere in the university yesterday, and somebody that's supposed to know, either a student or a lecturer, the person was busy telling a fellow colleague that COVID-19 is a scam, it's a political scam. But what interested me most was that the other person who he was talking to said, look, I've lost two of my very close friends to this pandemic. And that was sending a message to him. And this disbelief is making the populace to not want to keep the basics of infection prevention control to contain the virus. So you see somebody just going about his normal business without care for social distancing, no care for the use of face mask, no care for so people are not complying. And the reason for non-compliance is because some people feel that it is just a political scam. It's not a real situation.
Well, I will say this time, is this a peculiar case with Nigeria? Because again, like you said, that came to my mind too about disbelief, and the disbelief again coming from those that would be perceived to be seen as enlightened people who are now saying that COVID-19 is a scam. And then I want to also think about those that are very careful about themselves. Keeping to safety measures that have been put in place. But again, with others who don't in any way believe that this is happening, and so would just want to. So the fear and how we live now, and saying that we all might just be at risk of COVID-19.
Thank you very much. You see, there are two ends of the game. There are people that says there's nothing like COVID-19. It's a political scam. And you wonder why they say that. Because we have seen very influential people being infected and affected. We have seen sportsmen. We have seen ordinary Nigerians. On the admission list as of today, we have more than 50 persons in Kaduna Metropolis on admission for the infection. We have healthcare workers, our colleagues, who are infected and being treated. And we have those that have been discharged. So what we are doing in the area of disbelief is get people engaged, community engagement, community mobilization, talk to people at the community level, talk to traditional leaders, talk to community leaders, youth leaders, and so on and so forth, so that people can come to realization. This is real. Again, media engagement, like I'm doing now. We're also involved in taking testimonies from patients. Some patients are already giving consent to give testimony that, look, I have this infection, but now I'm either on admission or have been discharged. So this is to strengthen the populace belief and to take precautionary measure. Now the other side of the coin is people that are extremely fearful, and they stigmatized those that are either healthcare workers or those that even have the infection, that they know in their community have the infection. They stigmatize them because of fear. So again, to this category of people, we need to tell them clearly, COVID-19 is not a death sentence. We have seen that in this country, very few cases of death compared to other country. The form of COVID that we have in Nigeria, the strain is mild. It's mild from more than 98%, between up to about 98% of our cases are mild cases. And our case fatality rate, what I mean by that is that death rate due to COVID in Kaduna State are just about 1.2%. And nationally about 2.something%, about 2.3%, the whole country. So that means that it is comparable with other previous viral infection. Like we just come out of Lassa fever epidemic. You remember the Ebola time. Ebola had a case fatality rate of up to 15%. That is, if you have 100, about 15 people can die. and it's what they call viral hemorrhagic fever. So people die very frequently from Ebola. And if you remember, the citizens, Nigerian citizens and other part of the country, other part of Africa, even the entire world, people take the case of Ebola very seriously because of the death associated with it, and people can see it clearly. But the challenge we have with COVID is that COVID is just the symptoms are just like the ordinary symptoms that you know, talking of fever, cough, difficulty in breathing. So these are things that people have, sore throat and loss of smell. That's things that people are used to. So the problem is not the symptom. Our problem or the challenge here is the transmissibility. If one person gets COVID, it can infect quite a number of cases, and that was why if you listen to the chairman president asked for yesterday and the minister of education, there was this consideration to reopen school, but the minister was saying, excuse me, if you reopen school, one child in the class having COVID, the entire class can be infected. From that child, the entire community can get infected. And you know, children, they may not be as careful as me and you to do precautionary measures. Therefore, he said school should be under lock and key for now. So these are the issues. The issue is that people should know that this is real. And again, there should be no confusion to the issue of lockdown and the infection still being with us. Because some people are saying, okay, government is doing easing of lockdown because the disease is over. This is not over. The reason for the easing of the lockdown is to allow for economic activities, small scale enterprises, mechanic, laborers, tailors, roadside business people, and even the big industries. So everybody can go back to work. Commercial activities can resume. Both government and the populace can begin to make some economic gains. That's the reason for the lockdown. One. Another important reason for the easing of the lockdown to us in the health sector is for the health of the populace. Because health is a state of physical, mental, and social well-being, not merely absence of disease. It's not just because you are okay, you don't have fever, you don't have this, they say you are healthy. No. Physical, mental, social well-being. So during the lockdown, if you look at it, some people were going to the street to do exercise because there was this complaint that we are just at home, we are not doing anything. And what we call that in the health sector is they describe it as sedentary lifestyle. Sedentary. And sedentary lifestyle is associated with a lot of problems, including obesity. And when somebody is obese, a lot of it becomes a risk factor for a lot of health challenges like cardiac problem, hypertension, diabetic, renal problem, that's kidney problem. A lot of things can come just because somebody has is just gaining weight, and there's no way of losing those weight, and that happens when you are sedentary. Again, you remember there are reports of crime. So the issue of COVID is not only health, even security issues is involved. So considering all these issues, government has to say, excuse me, let us go ahead, let's ease the lockdown. Mental issue, psychological issue also involved. People are not going to work. People are sitting in one place. They have all manner of psychological problem, anxiety, fear, including suicidal ideation. What I mean is that somebody can even think of taking his life. This life is not worth living. So there are a lot of issues, both health-wise and economic-wise and security reasons, that led to the easing of this lockdown.
But the situation that we can still have on our hands is that for the figures that we're having now,
yes,
putting the figures out, across, these are known cases. These are cases that have been reported. And again, talking about a society like ours, where nobody wants to be discriminated against or stigmatized.
Yeah.
What about the so many people, of the populace who would not report these cases, and even with the symptoms shown, they will never, come forward?
Yes, you are talking of those that will not report the symptoms. Yeah. You see, there are a lot of issues about report of the symptom. But let me say this. You know, majority of the cases that we have in this country are from just 20 local governments in Nigeria. Majority of the cases, 20 local governments. And these local governments are concentrated in Lagos area, and a few of them on our side here. In Kaduna State, 12 local governments is where the infection is concentrated mostly. And out of these 12, it's highly concentrated in a very closed 7 local governments in Kaduna State. And the symptoms, as I've told you, they are just symptoms that people are used to. Now, reporting the case, one, there's individual responsibility, your responsibility, and my responsibility, and communal responsibility. Now, we have been emphasizing again and again the symptom of COVID-19. That, okay, somebody's having fever, has cough, have difficulty in breathing, have sore throat, have loss of smell, and this person have had contact with a confirmed case or a probable case. There is a need for this person to come out. Now we are doing community testing, community truck testing. So such a person, if the community truck come to the community, can volunteer for a test and be screened. That's personal responsibility. There's also family responsibility. Oh, this our brother, our sister, our friend is not feeling well. Let's take him to the hospital. If you do that, in the hospital, they have what I call previously SIN, screen and isolate and notify. They will do that in a normal hospital setting that have been trained on COVID-19, infection prevention control. And if that person fits into this case definition of being a suspected case, this person will be what? Will be screened, will be isolated, and appropriate authority will be notified in the ministry, and sample will be collected, and this person will be tested. So, you see, the issue of reporting is individual responsibility. And we have asked so many people who have come out, say, excuse me, I want to be tested for this infection. And this is what we are encouraging with this community test now. You know, initially when we started, we strictly test people who are suspected cases. But now we have extended it. There is now what we call active surveillance. Our team, our rapid response team, are now going to communities to look for, to seek for those who have symptoms that suggest to them to be tested. They bring them out, and also engage those that may wish to be tested, and they test them.
Let's come back home to what had happened in Kaduna State.
Yes.
The governor of the state, was one time infected with COVID-19.
Yes.
He had come out in a broadcast to say that he would not even want his enemy, to go through the experience.
Yes.
So Kaduna State took a lot of measures. Some people said it was too hard, too harsh. Interstate travels were banned. The markets were closed down. And of course, the lockdown was also in place. And this was seen to be so very harsh decisions to take, but government had to do that. And over time, government again talked about easing of the lockdown, which it did. And so Kaduna State, like any other state today, not safe because travels are all going on, and of course the markets. We've gone around the market and we've seen what has happened. Neighborhood markets, very frightening situation that you see there. And right now we are at the peak of community transmission. So, and we're hearing of deaths all around us every day, and people just say, he came down with fever, one fever or the other. People are dying. That's what we're saying. So, what at this stage that we are in Kaduna State, in Nigeria as a whole, can we, some states of the world have done that. Have done ease on lockdown, and have gone back to lockdown again. Are you saying that, that's the case for Nigeria and Kaduna State?
Thank you very much. You see, we need to thank His Excellency, the Governor of Kaduna State, Madam Nasir El-Rufai, for a good job done. And just as we have said before, he has shown that he's highly educated and pragmatic leadership. That's what we have seen. You see that there are states where they are in denial, but that is not the case here. So we need to thank him. And we need to appreciate our rapid response team in the state. People have compared what we are doing in Kaduna State to other states, and we have received a lot of kudos. we have received a lot of kudos from the neighboring state, including the FCT. So we need to appreciate what is happening. Although we have not reached there, we have not. We cannot begin to clap for ourselves because we are still on the field working. But the question was, you were asking me specifically that the easing of lockdown. Other country, look at South Korea. South Korea eased the lockdown, but after some time, there was a second wave, or a supposed second wave, and there's a need to go back to the lockdown. The same thing happened in the US. You see this situation in the United States. The cases were coming down. Even in the whole of the 50 states of the United States, they had to do a holiday, a kind of a easing of the lockdown. But what happened after that? There was a surge. The same thing is happening in Nigeria. If you look at our epidemic curve, see, before the lockdown, the cases are not as much. There's a surge now after the easing of the lockdown. Now, when you ease a lockdown, when there was no movement as much as possible, when it was restricted, you will notice that there is a decline in number of cases reported, and that can be attributed to the nature of the infection. We have said it's person-to-person transmission, person to person. So if there is no person-to-person transmission or it's restricted, of course, the expectation will be a decline. Now, we have explained that because of so many reasons, there's a need to ease the lockdown. Again, but it comes with regulations, come with rules. Okay, we are easing this lockdown, but observe social distance. The principle of social distancing must be observed. The principle of face masking. And when we talk of face masking, we're talking of appropriate use of face mask. What I have seen on the road now, or in the street, is people using face mask anyhow, without not using it properly. Somebody is using face mask on the chin, the mouth, the nose exposed.
I quickly want to talk of the face mask. Again, just watching a video, someone, a driver in the car.
Yes.
Now, why would a driver in the car with nobody, why would he have his face mask on? And face mask, at what point do we, would you, be recommending that face mask must be used? If I am in a car driving and with nobody in my car, why would I have a face mask on?
Is it the issue, we were talking of easing on lockdown and the consequences and what can happen. We still come back to that. But we're just talking now about the use of face mask. Face mask is used person to person as much as possible. If there's going to be a contact between two persons or a group of people, there's a need for them at this time to maintain social distancing at least 1 meter, 3 feet away. When you add face mask, you reduce tremendously the risk of transmission. So as long as you're going to be coming out in contact with people, we encourage that you use face mask. But somebody inside his car, who is alone inside the car, and is driving his car, he may not be on face mask. But if the person is going to wind down the windows of his vehicle and there are people in the community, in the environment, there's a need to put a face mask. So the principle is that when you come in contact with people or you are in a group of people, there's a need to put a face mask. If you are alone in your house and you are no other person is there, there's no need for the face masking. That's the principle.
Okay, I'm sure now we'll have to go for a commercial break. We'll be back with you. The program is Perspectives this morning, and coming to you on Invicta 98.9. It's a sponsored program by the State Ministry of Health. We'll be back with you shortly.
Test 1 2 1 2 2.
Think of anything better. Invicta 98.9. Hit music.
Tell me while I do my money dance like, hey. Flexing on the gram like, hey.
Yeah, you for there for me. You for there. When you find it over.
Fantastic program.
Invicta FM the Sabua. Invicta Sabua. Invicta FM the Sabua.
Show brilliance. Excellently combined. Best of both worlds. Invicta 98.9. April 9. David Summers, effective out of April 9. NASA.
We'll be right back after this quick commercial break. Are you serious? For real, are you serious? Victor FM.
Welcome back as the program Perspectives this morning with Dr. OYEFABI ADEGBOYEGA Moses, consultant, public health physician, Barao Diko Teaching Hospital, also senior lecturer, Kaduna State University, and team lead, Infectious Disease Control Center, Kaduna. And we are talking about COVID-19 here in Kaduna State and, of course, at national level. Doctor, again, and the situation that we have on our hands, again, is going about, we are a religious people. Nigeria has been said to be that. We are religious people. And at the advent of COVID-19, God was put in the front of all, that he takes care of all. And so everyone just were on the loose about God will take care of the situation. But again, what we were told is that take care of yourself, and so that God will do his own taking care of yourself too. But again, what is happening now? Older people, are told to stay away from the crowded churches and the mosque, and the young ones of, up to 12 years also to stay away. But again, people are also still questioning this belief, this total trust and commitment to God in COVID-19. How do we address that?
Thank you very much. If you notice, even the federal government has called for national prayers, both in mosque and in churches. I think that was observed last Friday and then Sunday. Some times of fasting was also declared by the Christian Association of Nigeria, which has been observed. Nigeria is a religious country, and we thank God for that. And God will definitely help us in this situation. That is true. But as much as that is true, we need to take personal responsibility. We need to take personal responsibility. And this personal responsibility is what we have been saying, that the principle of social distancing in any overcrowded places, going to church, going to mosque, this must be observed. Social distancing. There must be a gap between one person and the other. And the place of worship, there should be emphasized the use of face masking, and people should also have opportunity to wash their hands. Very importantly, even as we are praying, we should put in place measures to contain the infection. And that's how God can help us better. So that is about infection prevention control in overcrowded places. Then you also remember the Champion League, the La Liga, viewing centers. These things resuming, and there's also gathering not only in religious places, but also at viewing centers, gathering at other public places, gathering for naming ceremony, burial ceremony, and all that, and weddings. So in all this, we must observe the principle of social distancing, and there should not be gathering of plenty people in occasions. As much as possible, but people should still take responsibility of staying at home on their own and going out only when it's necessary. Few centers need to be controlled, that not more than this number of people can enter this particular place. And if that is not observed, thank God we have the law enforcement agency to ensure that. So we are talking before about this lockdown and what can result if we don't take precautions. Let me take us back to the Spanish flu. Much talk about Spanish flu of 1918. Remember, there was the first wave and the second wave of the infection. There was a lockdown. The flu lasted about 2 years. At a point, there was a need for government for a lockdown. That was a lockdown. But because of impatience of people are talking, just the way we are now. That flu, according to what we had, affected about 500 million people. The majority of the casualty occurred during the second wave. When we say wave, first wave, when you have the first spike, then because of intervention, just like now you lockdown, there is an epidemic, you lockdown, or pandemic, you lockdown, then the wave decline. So when there's a complete decline of the case, you say the first wave is just like a cough, up, down, it's over. But when people now begin to ease and begin to relax, then there's another sustained rise of the epidemic. That's the second wave. And during that second wave, according to what we had, there was a terrible fatality. The same thing we are observing now. We are observing, or we have seen now, in China, in Korea, in the United States, and part of Britain. So lockdown is good. And I mean, the easing of the lockdown is good. But more importantly, it will be better if we observe these principles, so that there will be no need to go back to a lockdown. Then the question that you ask me is that if we are going to do a locking, which I'm not praying for, what are the things that the policymaker may consider? There are some things that they will say, excuse me, we need to do a relock. And one of the things they will consider is if there is a surge in positive case. Now, if there is an increase, a sudden rise, the number of people who are getting positive, of course, the government and the health policy leaders will not keep quiet. They may advise the government to do a relocking. And if you remember now, even the President Task Force are saying that they may likely inform the president about the need for a lockdown. So if surge in positive cases, now before you know, Nigeria were having less, at the onset of this pandemic, we have less than 20, 10, 15, 20, 30 cases. But suddenly, there was a time we have 150 something cases, and it will come in national news. But today, you know, in a day, we can record more than 500, 600, 800 cases in one day. So when this kind of thing persists, it can call for a lockdown if the cases are increasing. Number two, a spike in hospitalization. Maybe at the isolation center. You know, you can have positive cases not reported. But when we begin to see high number of cases who are either being managed in isolation center, or who are under our care in home-based management cases. So this spike will also call for consideration, advice to this policymaker. Look, this thing is increasing. Let's do what? A lockdown. When you have a rise in healthcare workers who are being infected, now in the state we have quite a number of our colleagues, healthcare workers, doctors, nurses, even attendants, and other healthcare workers, environmental health officers, who are being infected because of at the point of their work, coming in contact with confirmed cases. So these are some of the things policymakers may consider. Then when we have lack of compliance, as we are experiencing now, with preventive respiratory and hand hygiene measures, as people are saying, God will help us, and they are not taking any personal responsibility, this may call for a lockdown. The breach, as I've told you, in social distancing measures. People just do their naming ceremony, burial ceremony, wedding ceremony, just the normal way. And you know, the other day we were talking about new normal. There's a need for us to maybe a very change to accept these new normal situations. So these are some of the issues that when the hospitals are becoming overwhelming of the health centers, when we cannot undo the number of cases that are coming, then these are some of the issues that we may have to consider when we are talking of a lockdown. But we are not praying again that this will be the case.
Well, you took that, from me, but because I was coming down to, the health centers and health personnel. What we see in our health centers today, again, the ease of the lockdown too has, taken its toll on the health centers, where too we see that people come in, of course, face masks, but again, you begin to wonder the interaction that goes on with people there. And then you talk about the health personnel too, how safe they are. Are the health personnel really safe, to treat patients that come in? Most people may not come with the COVID-19, other health matters.
Yes.
But, exposure to it that may lead to COVID-19.
Thank you very much. As I have said, quite a number of our colleagues
Yes.
are affected. And the state recorded one death, although there was a lot of issues about another death from the state, making two from healthcare workers. But my interaction with healthcare workers to get idea of how these things, how some of our colleagues are getting infected, mainly is when we have not when we have not used the infection prevention control measures as much as possible, or when we don't have access to some of those material, the personal protective equipments. So this exposes healthcare workers highly exposed to the infection. One, lack of personal protective equipment in facilities can expose our colleague to the infection. Secondly, attitude. You can imagine healthcare workers who will put face masks away from the nose, only the mouth is covered, or just hanging on the chin. Or an healthcare worker who will not follow the principle of hand hygiene. We have taught 5 moments of hand hygiene for healthcare workers. We say before you touch a patient, after you have touched a patient, make sure you wash your hand or perform an hand hygiene. When you are going to perform a procedure or aseptic procedure, you are going to fix a line for a patient, you are going to feed the patient with nasogastric tube, or any other invasive procedure for the patient, you say make sure that you wash your hand. When you have come in contact, that's the 4th one, with the environment, the patient environment, the patient surroundings, wash your hand. And we say when you have soiled your hand or soiled your clothing, when you are visibly soiled, when from the product or from the patient, wash your hand. So the hand hygiene techniques, if precaution is taken, and we keep to what we call standard precaution. What do I mean? You treat all patients as COVID. Hello, until proven otherwise. You don't say this is malaria, this is COVID. Then for COVID, you put your face mask, you put even your gown, whatever you want to do. Then for non-COVID, to you didn't perform. This is not any infection prevention control. You just do as normal as you know before. This is not the time. All patient is managed the way you prepare, as if to say you are going to manage a COVID patient. And in hospital, there should be social distancing measure. You don't invite all the pregnant women to come for antenatal at the same time now. You space it so that there will be social distancing. So some clinics are also spaced. Times are given for people, an appointment for people to come to the hospital, so that the place is not overcrowded. You have to plan your hospital. You have to know your target population and plan as much as possible for social distancing principle in facilities. Otherwise, if you are crowding the hospital and we are not taking some of these measures, healthcare worker infection will continue to rise.
Okay, I just quickly would have to go to the audience now. Let's get your concerns here too, and what is happening at your immediate environment. Just call us on these numbers: 081 40989, 081 40989, or 070 87 800 989, 070 87 800 989. Hello, good morning. Okay, I'll take your calls now. Hello, good morning.
Good morning.
Good morning.
Good morning, guest.
Yes, good morning.
Your on to Emmanuel.
All right, engineer.
Yeah, your girls have spoken very well. You see, where I'm having concern concerning this pandemic that is before us. You see, NCDC have a guideline, and they have been telling us about this guideline. But the problem I'm having, we are not observing the social distance that are set before us. We are not observing it. So that I stand to be corrected. Goes to the police station, goes to the hospital, goes to government offices. They are not observing the social distance. And this pandemic is not written in the face of anyone to know who is the carrier of this virus. So how do we now enforce this social distance? Because even those that are ahead of ourselves, yes, they are not exhibiting this social distance. For God's sake, this number keep rising up by the day. Today we have 30,200 and something. We don't know what the outcome by tomorrow morning. So please, those that are ahead of ourselves, they say social distance, putting up face mask. People are not doing it.
Okay, Engineer Iman, we'll take on that. We'll take on that. I'll take another call now. Hello, good morning.
Good morning, Mr. Tenyala.
Good morning.
Good morning to your guest.
Good morning, sir. Thank you.
This is Chief Amoto Kobunigwe calling from Kaduna.
Okay.
Mr. Tenyala, let us tell ourselves the truth. In this pandemic, it's killing both the rich and the poor. But I'm telling you the truth and nothing but the truth that the common man suffer it more than the government officials. And who are the contributors of this COVID-19? I'm telling you also that it's coming from the government. See, mobile court here and there. You can never see the mobile court prosecuting maybe a civil servant, for example, government officials who did not even take the social distances. But you will see Keten Apepe who carry 3 passengers. Each of them will pay 5,000 naira. It's very unfair. It's very, very unfair and it's barbaric because common man is suffering more than what the government are doing to us. It's more than what we bargained with them in 2015 when they are coming in power and 2019. What they told us is not where we are today. Please, I'm begging, especially Kaduna State government. This money they are recovering. We are not even seeing it on the progress of Kaduna State. Please, it's getting too much.
Okay.
We are tired of this thing. Thank you and God bless.
Thank you. All right, we'll take one more call and then come back to our guest. Hello, good morning.
Hello, good morning, sir.
Good morning.
Good morning to your guest.
Good morning, sir.
I'm Comrade Gabriel, the Texas man. Sir, I just want to ask, what is the position of this palliative that they say they should give to people who used to remain at home? Because
we're not on palliatives today, Comrade Gabriel.
Because what the doctor is saying, what he's actually saying that if you are not having something spare to do, you're supposed to go outside. And a lot of people are not out of businesses and others. What is the government doing so that this thing will reach us, we that we are not going outside? Thank you.
All right.
Thank you very much.
I'll come back to you, Dr. OYEFABI.
Thank you, our callers. Mr. Emmanuel has raised a very crucial issue. There is a need to observe social distancing. You see, there is something we call reproductive number, and that's the number of person each person can pass the virus to on average. If we do social distancing, the reproductive number of person that each person can pass the virus to will decline. So we have to take the issue of social distancing seriously. And that's what the second caller was talking about the need for enforcement of the law.
But again, here Chief Amotekun was talking about selective justice.
The truth is that the government agencies are watching, and anybody caught doing that will be questioned. It's not supposed to be selective. It's going to be for everybody. Nobody's above the law.
And for Comrade Gabriel, talked about
it's talking of palliative.
So
now we are talking of taking personal responsibility. Now you can go out, but the idea is that go out only when it's necessary, not going to visit all your friends. You go out only when it is necessary, and you make sure that where you go, there's no overcrowding. There are social distancing principle in those places.
All right. I'll squeeze in one call and then squeeze in one call. Hello, good morning. Hello, good morning. Okay, holding on the line. Hello, good morning. still not on the line. Hello.
Hello, good morning, sir.
Yes, good morning.
I'm Kislan, I'm calling from Solo.
Keslan.
Please, I want to ask, these PPE, are they available in hospitals? Especially these are general hospitals. So if you go to these general hospitals, you hardly see doctors putting on this PPE. Even the face mask and the hand glove, if they want to observe patient, they will ask the patient to go and buy common hand gloves before they observe them. So what is government doing towards that area? We was coming on radio to tell us that PPE or this, we are going there, went to general hospital, that's for one at a time. But
Okay, doctor.
Okay, thank you very much. As much as we know, there are PPE available in the state, and they are distributed to each of our facilities. But the issue he has raised, we will pass what he has said to appropriate authorities, and those matters will be investigated.
All right, Doctor, if I could just give us the last line, or no, always.
So the last line will still be that the easing of the lockdown is not the same as the end of the pandemic. There's a need for us to take personal responsibility to contain the virus. Thank you.
And that will just be about the size of it on the program Perspectives this morning. And we stayed on COVID-19 at the national and state level. Dr. OYEFABI ADEGBOYEGA Moses, consultant public health physician, Barao Diko Hospital, teaching hospital, and also senior lecturer, Kaduna State University, team lead also of Infectious Disease Control Center, Kaduna, has been my guest this morning. Doctor, thank you for coming on the program.
Thank you, sir,
all right,
for having me.
Thank you. We'll come back with Perspectives tomorrow, same time, same station. Dashin, thank you for connecting us with the people. Good morning.
Everything that rocks. In Victor FM, be victorious.